Greetings, class. I wanted to take just a few minutes of your time to provide you with an overview of the content within Module 1. From the readings, you've probably understood that nurse educators must use a multitude of strategies to assess and to evaluate student learning. Importantly, these strategies must be evidence-based. It's important for you to be able to differentiate between assessment and evaluation. So, do you understand the difference between assessment and evaluation? Are you able to differentiate between them? Assessment refers to those measures that provide information about students before, during, and after participation in learning or in a program. Assessment may include both quantitative and qualitative data. When we talk about assessment, it's important that we talk about measurements. And there are two types of measurements. And it's important that you're able to differentiate between them, norm referencing and criterion referencing. Norm referencing occurs when we compare students, a student's score or his or her performance with others in a group. Now, the disadvantage of norm referencing is that it does not provide a means to judge students' achievement of the outcome. So while we're comparing the student's score or performance to others in a group, we're not given information in terms of whether or not the student has achieved the outcome. Conversely, if we look at criterion referencing interprets scores based on preset criteria. So when we talk about preset criteria, what does this mean? This means that there's going to be a checklist or a rubric. The most common examples of criterion referencing include exam scores and then oftentimes evaluation of psychomotor skills because we will see a checklist or a rubric. Now, we've talked a little bit about assessment. When we talk about evaluation, we appraise quality. And there are different types of evaluation. The RSA model, which is described in the Bastable textbook, will provide you, or rather does provide you, a visual of 5 different types of evaluation. These include impact, outcome, content process, and program. It's important that you're able to differentiate between summative and formative evaluation. So think about the difference for a minute. Are you able to differentiate between types of summative and formative evaluation? Teachers will make immediate changes in instruction based on formative evaluation. Formative evaluation occurs in the middle of instruction, where summative evaluation occurs at the end of instruction. So when we're talking about summative evaluation types, you might hear mention of final grade, you might hear mention of portfolio, you might hear mention of capstone project. Now, tests play an integral role in evaluating student learning as well as progression through a program. Let's take a bit of time to focus on tests because they are abundant in nursing. We know, or I think that we understand, that it is important for you to use test blueprints. Test blueprints connect content and outcomes to test items. How many of you have worked with test blueprints? There is an example in the module contents that I would encourage you to take a look at. A test blueprint should accompany every exam and in nursing and within that exam connect to nursing categories. We utilize blueprints because we want to make sure that we're testing on what we should be testing on. We don't want to get to the end of the course and wonder, should Patty or Jane have been dismissed from the program? Was I testing on the material that was presented? And is that content relevant and included in the NCLEX RN test plan? So the blueprint will pull all of that together for us. We want to make certain that we keep students in the program that deserve to be in the program. And we need to make certain that our tests are linking the content and the outcomes to the test item. We want to make sure that we're testing on what we should be testing on. And with that being said, it's important that you understand reliability and validity. You should always be asking yourself, what is the reliability of this exam? Now, we'll talk more about reliability statistics later on this term, but for now, I think it's important that you commit to memory information relative to the Kuder-Richardson formula. We will discuss in more detail as we move forward. I encourage you to ask questions across the discussion thread if you have any questions or concerns, and I look forward to our discussion this week. Thank you so much.